This video of mine is about athlete's foot, which is also known as tinea pedis in medical terminology. Before this, I have already uploaded a short video about this illness on my channel. I hope you have already seen that video, and today I will discuss this illness in detail. Well, tinea pedis is a fungal infection that usually begins between the toes. It commonly occurs in people whose feet have become very sweaty while confined within tight-fitting shoes. Signs and symptoms of athlete's foot include a scaly rash that usually causes itching, stinging, and burning. Athlete's foot is contagious and can be spread via contaminated floors, towels, or clothing. Athlete foot is closely related to other fungal infections such as ringworm and jock itch. It can be treated with over-the-counter antifungal medications, but the infection often recurs. Prescription medications also are available. Now I will tell you the symptoms about this illness. Athlete's foot usually causes a scaly red rash. The rash typically begins in between the toes. Itching is often the worst right after you take off your shoes and socks. Some types of athlete's foot feature blisters or ulcers. The Caucasian variety of athlete's foot causes chronic dryness and scaling on the soles that extends up the side of the foot. It can be mistaken for eczema or dry skin. The infection can affect one or both feet and can spread to your hand, especially if you scratch or pick at the infected parts of your feet. If you have a rash on your foot that does not improve within 2 weeks of beginning self-treatment with an over-the-counter antifungal product, you should see your doctor. If you have diabetes, you should see your doctor if you suspect you have athlete's foot, especially if you notice any signs of a possible secondary bacterial infection such as excessive redness, swelling, drainage, or fever. Now I will tell you the causes. Well, athlete's foot is caused by the same type of fungus that causes ringworm and jock itch. Damp socks and shoes and warm, humid conditions favor the organism's growth. Athlete's foot is contagious and can be spread by contact with an infected person or from contact with contaminated surfaces such as towels, floors, and shoes. Now I will tell you the risk factor about tinea pedis. You are at high risk if you are at a high risk of athlete's foot if you are a man, frequently wear damp socks or tight-fitting shoes. If you share mats, rugs, bed linens, clothes, or shoes with someone who has a fungal infection, or if you walk barefoot in public areas where the infection can spread, such as locker rooms, saunas, swimming pools, communal baths, and showers. Now I will tell you the complications of tinea pedis. Your athlete's foot infection can spread to other parts of your body, including your hand. People who scratch or pick at the infected parts of their feet may develop a similar infection in one of their hands. Your nails. The fungi associated with athlete's foot can also infect your toenails, a location that tends to be more resistant to treatment. Your groin. Jock itch is often caused by the same fungus that results in athlete's foot. It is common for the infection to spread from the feet to the groin as the fungus can travel on your hands or on a towel. Now I will tell you about the diagnosis of tinea pedis. Well, when the patients come to us, it's usually very easy to diagnose just by looking at the patients. Suppose if somebody is having tinea pedis, it's very easy to diagnose just by looking at the signs. Okay. To help confirm the diagnosis and to rule out other conditions, we might take a skin scraping or skin sample from your foot for testing in a lab. Now let me tell you about the treatment of this illness. If your athlete's foot is mild, we may suggest using an over-the-counter antifungal ointment, cream, powder, or spray. Well, there are different creams and ointments are available, such as clotrimazole cream, and there is a cream which is come with the name of Lamisil cream, and the generic product in that is terbinafine. So when we prescribe this medication, or which people buy over the counter these cream, then if they apply for like 2 weeks, morning and evening, then usually the mild or moderate infections can be settled. But sometimes we have to give in severe cases, sometimes we have to give oral antifungal tablets, okay, such as Lamisil tablets are also available, okay. So it depends upon the severity of infection. As I told you before, mostly the mild to moderate cases can be easily treated with over-the-counter antifungal creams or ointments, okay. Now I will tell you about some prevention strategies, in lifestyle and home remedies. The tips which I am going to tell you can help you ease the symptoms of athlete foot or avoid a recurrence. The first tip is that you should keep your feet dry, especially between your toes. Go barefoot to let your feet air out as much as possible when you are at home. Dry between your toes after a bath or shower. Also, you should change socks regularly. If your feet get very sweaty, change your socks twice a day. Wear light, well-ventilated shoes. You should avoid shoes made of synthetic materials such as vinyl or rubber. Alternate pairs of shoes. Do not wear the same pair every day so that you give your shoes time to dry after each use. You should protect your feet in public places. Wear waterproof sandals or shoes around public pools, showers, and locker rooms. Treat your feet. As I told you before, you can use over-the-counter antifungal products as directed daily. For example, creams may be applied to dry feet twice a day and used for a week even after the rash is gone. You should try not to scratch the rash. You can try soothing your itchy feet by soaking them in cool water. Also, do not share your shoes. Sharing risks spreading a fungal infection. So this is very important. So this was my video about tinea pedis, which is also known as athlete's foot. It is why it is called as athlete's foot, because it is common in athletes, okay. And if you have any questions or if you are suffering from this illness, you can post in comment sections. And if you are suffering from any other illness, you can post comments in the comment section of this video. And if I get a time, I'll try to make a video about your illness, okay.